Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is August 26, 2021, and this is our COVID briefing. Today in Missoula County, we're reporting 73 new cases of COVID-19 since yesterday. We currently have 614 active COVID cases and have had 107 deaths since the beginning of the pandemic. We continue to see our hospitalization numbers going up, and today we have 21 Missoula County residents hospitalized and 9 out-of-county residents hospitalized in our county. And our average daily new cases also continues to climb, and we're now at a 7-day average of 48 new cases per 100,000 people. Just a reminder, once we're over 25 per 100,000 people, it's considered high transmission and above the tipping point. To put this in perspective, the last time we saw numbers this high was back in the middle of January, before vaccines were widely available. So today I'm going to talk about the special Board of Health meeting that occurred earlier this week, delays in contact tracing and how you can help, changes to our capacity for testing, updates on available vaccines, and safety when it comes to large events and school starting. In the future, I'll try to post these briefings more frequently, so we're not trying to cram quite so much information into one video. Okay, so first let's talk about the Board of Health meeting. Many of you likely watched or have read articles about Tuesday's special Board of Health meeting where the board decided that we should continue to follow the CDC's guidance on quarantine for close contacts that differs between vaccinated and unvaccinated individuals. That meeting largely spoke about the issue in broad terms, so we want to clear up some confusion that may come from that. Generally, unvaccinated close contacts who don't develop symptoms and test negative for COVID-19 on their day 5 or later after exposure need to quarantine for 7 days. If they develop any symptoms, they also need to isolate, which means that they must separate themselves even from others in their own household. Vaccinated close contacts do need to quarantine after exposure until the health department has proof of their vaccination status. Once we have that proof, then most vaccinated close contacts just need to get tested 3 to 5 days after they're exposed and wear a mask for 2 weeks whenever you're around other people. However, if your test comes back positive, then you would need to then isolate. If a vaccinated close contact develops COVID-19 symptoms, they will also need to isolate and get tested. There are also a few other circumstances where vaccinated people may not be able to get around quarantining, such as a vaccinated parent who's caring for a COVID-19 positive child for several days, resulting in continuous exposure to the virus. These special circumstances are why it's really important for anyone to actually talk to the health department staff when we call you, just so that we can see what your own individual circumstances are. So moving on to close contacts, due to the large volume of close contacts reported by most positive COVID-19 cases in Missoula County, it's taking us about 4 days or so to contact close contacts. We're asking positive cases to inform their close contacts that they need to quarantine so that that 4-day delay doesn't contribute to further spread of the virus in our community. We super appreciate your cooperation with this ask. We are hiring and training people as quickly as possible right now and really hope to get back to notifying people within 24 hours soon. The other thing that you can do to help with this is reducing the number of people that you're around. Compared to this time last year, we're seeing about 2 to 3 times as many close contacts per case. So keeping your social circles small can really help us get back on track. So now let's talk about testing. Due to the large volume of cases in Missoula County right now, we are having to limit our COVID-19 testing to only symptomatic residents and health department verified close contacts. Furthermore, due to staff shortages, we're not conducting our mobile testing on Tuesdays and Thursdays in Clinton, Seeley Lake, Lolo, and Frenchtown until further notice. We will be resuming that mobile testing as soon as we can, hopefully in the next few weeks, and we'll make sure that you know when we are able to do that. Okay, so on to vaccines. On Monday, the FDA gave full approval to the first COVID-19 vaccine, the Pfizer vaccine known as Comirnaty. I'm not even sure if I'm saying that correctly, in individuals 16 years of age and older. That vaccine is still approved in ages 12 to 15 under the emergency use authorization. The licensing application included more than 340,000 pages of material, which is about 3 times the earlier emergency use authorization submission, which weighed in at 110,000 pages. America and Montana's top doctors and infectious disease experts do stand by the vaccines and encourage all eligible residents to get vaccinated. High vaccination rates are really the best chance that we have to end the pandemic. As far as Johnson & Johnson, I just want to let you know that the clinic at Southgate Mall will not be offering the Johnson & Johnson vaccine until further notice. It is in short supply nationwide, which is preventing us from being able to order more of that vaccine. We will let you know as soon as we are able to start getting that again. As of today, all of the vaccinated residents in Missoula County, only 0.71% have actually experienced a breakthrough case of COVID-19. This means that the vaccines do work, and we highly encourage everyone to get the COVID-19 vaccine. When it comes to boosters, we are doing the third dose of Pfizer or Moderna for immune compromised residents. So if you are immune compromised and you've spoken with your doctor and they think that you need to get a third dose, we can certainly provide that at our Southgate Mall location. Right now, we don't have any further information on booster doses for the general population, but we will relay that information as soon as we get it. Okay, so large events. The community has some large events coming up that residents should still stay cautious at. If you attend a large event, keep to your pod of people that you're attending with and try to socially distance from others. Wear a tightly fitted mask. Try to stay distanced if you take your mask off to eat or drink. Frequently sanitize your hands and don't attend if you have any symptoms of COVID-19 or if you feel ill at all. Also, after attending a large event, really keep an eye on your own health. And if you start to develop symptoms, then call our 258 info and we can get you scheduled for a test. School is starting, and we highly encourage all kids to wear tightly fitted masks and sanitize their hands often while at school. We do ask that you please do not send your kids to school if they're having any symptoms, no matter how mild, of COVID-19. We also highly encourage parents to get kids 12 and older vaccinated against COVID-19. This not only protects your child, but it helps to protect kids with who may be immune compromised that your child may attend school with. And last, I just want to announce that we do have several open positions available. I think we're looking to hire about 80 more people right now as we continue to respond to COVID-19 in Missoula County. So if you're looking for employment, please check out our website at missoulainfo.com/jobs. It's really easy to apply. You just have to submit your resume to the email that's provided there. Okay, so that was a lot of information for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. We do post information there frequently. You can check out our website at missoulainfo.com. That is updated with our daily information on our data dashboard. So if you want to keep an eye on the trend and what's happening, you can check it out there. And you can call 258-INFO if you would like to schedule a test or if you need assistance in scheduling for a vaccination appointment or if you just have general questions about COVID-19. As always, stay healthy until next week, everybody.